Hi, and welcome to Catastrophic Comeback Takeaways. I want to talk to you for a few minutes about my conversation with Shaun Sever. Shaun Sever is a very experienced nurse. We use her, and several other firms around the country use her in catastrophic cases to quantify and perform future medical analysis. So, for example, when a person has a permanent injury that might require ongoing medical attention, we can't wait until the end of that treatment in order to try to build an expert report, try to build out the damages from that permanent injury, because that treatment may go on forever. It may go on for the rest of the person's life, and so we have to find a way to account for it, even though it has not taken place yet. And so that's where Shaun comes in. And so anytime there is a future medical permanent injury or a future medical treatment is warranted in the medical bills and records and prescribed by the treating physicians, then we want to get Shaun or someone like Shaun in place to calculate those future medical expenses and to calculate that future medical treatment. And especially in situations where it's a catastrophic injury, it might require a life care plan. And so if you'll recall, the way that she describes a life care plan is not only the future medical treatment that the person might need, but anticipated surgeries, anticipated attendant care, anticipated medical equipment, and all those different things that might go into a comprehensive life care plan for a person catastrophically injured. I thought that was an important description that she gave. The second thing that I thought was important about what Shaun described is this the idea that if a person has a serious injury or maybe loses a leg, how might that affect a person's other leg, their knee, their ankle, their hip, their back, when they're compensating for all the injuries that might have, all the ways that they might compensate for the primary injury. What wear and tear does that put on the other parts of the body, and how that needs to be quantified by an orthopedist in order for her to be able to perform her analysis and projections with respect to future medical analysis. So I thought that was interesting. The other thing I thought that was interesting about my conversation with Shaun in particular was that we're seeing a recurring theme of people who are describing depression and mental health and mental and emotional injuries that result from these catastrophic accidents. 20 years ago, that wasn't as big a deal as it is now. It wasn't as accepted as it is now, but now it seems like it's almost common sense that if somebody has one of these catastrophic injuries, you have to treat the body, of course, and there's medical doctors that will prescribe a course of treatment for a person's recovery or improvement as it relates to that injury. But it's also critical to assess a person's mental state to determine if that person needs mental health counseling. And this mental injuries can manifest themselves in different ways. And historically, people kind of have thought of that as weakness, and I think that's a mistake. And I think people are recognizing more and more that these injuries, these mental health injuries, can manifest themselves in terms of depression, anxiety, irritability, frustration, sleeplessness, and those kinds of things. They can self-medicate through prescription medication or alcohol, and we want to try to recognize those injuries, get them diagnosed properly, get them documented properly, and get them treated properly so that a person can have a comprehensive recovery process. And that's all part of our mission, to help people recover physically, financially, and emotionally after catastrophic accidents. So I hope that was helpful to you, and thank you for joining us.